first of all, I just wanted to welcome you to our talk about the Australian Breastfeeding Association and the breastfeeding talk that we give here at the Expo. So firstly, I especially want to welcome all the dads in the audience. That's really fantastic because we have really good knowledge now that the support of a supportive partner really does make a huge amount of difference. Let's see if I can click that onto the... Yeah, so when you're expecting a baby, obviously we spend a lot of time thinking about the pregnancy and the birth. It's a big thing that's coming up, right? Often we don't think so much about the breastfeeding, which comes surprisingly soon after. And we know when dads are involved or a supportive partner is involved, that the support and knowledge that they have really can make a difference of tenfold. So why is breastfeeding important? Well, it's important for baby. Most of you probably know all about the benefits for babies. Benefits for mothers too are really important. So for babies, obviously, it's what babies were designed to have for their nutrition. It's a complete food, so both their food and their drink is included. When a baby starts feeding, they're getting a thirst-quenching food, and as they continue to feed, that is their food. For mums, it's convenient. It's always available. It's fresh. It's always at the right temperature. It's available and convenient any time, which makes a big difference. It helps to quickly soothe a fussy baby, especially if the baby's unsettled or unhappy and you're not sure why. You can always try feeding. There's obviously going to be other causes too. Sometimes they just want to be close. Sometimes they need a nappy change. But if a baby's unsettled, then you can always offer another feed because it's like having another drink. So many of you may be due in the summer months, so baby may be quite thirsty. That's often a cue. For mums too, it's really important. It helps to return your uterus to the size that it's meant to be. So it helps it to contract, reduces blood loss. For babies, it's meeting both, as I said, their hunger and their thirst. And it's always changing. That's the really good thing about breast milk. So it's always adapting to the baby's needs. So that might be adapting when the baby is first born. It's colostrum. Then it transitions to more mature milk. When the weather's hot, it changes. When the baby's ill, it changes. As they grow and develop, it meets their nutritional needs. As they start to get more mobile, those immune factors boost back up like it did when it was in the early days. It also aids sleep and bonding, which is a really good thing for parenting. So that's important for mums and dads to know, that close contact and keeping you together, especially in the early days, straight after birth, having baby skin to skin, close together, and holding baby close, lets baby get to know the environment, gets to recognise mum. As we said, it's also important for mothers, but also more so for your own financial situation, for returning to work. It means that there's less likely to be time off work. All those kinds of factors are really beneficial. Even just the fact that you're not having to spend money or on advertising and the transport of all those other things, you just take everything that you need with you, and it's totally portable. It means that anywhere you can go, your baby can go with you. So, lots of mums and dads often wonder, they've heard bad stories or people had difficulties with breastfeeding. So they wonder, will I be able to breastfeed? And the good news is that if you've got at least one breast and you've been pregnant, the chances are very good that you will be able to breastfeed. But the real difference that it makes is the right support at the right time. So we know and often trust in our babies being nurtured and cared for. They're being rocked and soothed inside our body. All their nutritional needs are being met. And we need to trust our bodies afterwards, but often things can get in the way. So when we need help, it's really important to get help and support right away instead of waiting, thinking, I'll see how it goes in a week or two, because everything's changing for babies really, really fast, especially in the early days. So getting help right from the beginning is really important. And the more you know about breastfeeding beforehand, the better. So on that point, it's the Australian Breastfeeding Association actually runs breastfeeding education classes. So just like you go to your birthing classes, we also run classes for just about breastfeeding. And it comes so surprisingly quickly after the birth that it's really not a great time to be trying to learn in that hour. When you've just given birth, all about breastfeeding. So if you can learn more beforehand, you've got time for it to sink in, then you're applying what you already know instead of trying to learn it from scratch when you've just been through a birth experience and you've got a baby in your arms already. So the World Health Organization recommends, and Australia's Health and Medical Research Council both recommend exclusive breastfeeding for the first 6 months of life. That means that's all that baby's going to need is your breast milk. doesn't need anything else in that time. And for how long? Well, that's really a choice for mother and baby or for the whole family to decide. And the Australian Breastfeeding Association is here to support you whatever your breastfeeding goals are, whether it's days, weeks, months or years. We're here to support you throughout your breastfeeding journey and even beyond. So we have lots of people who keep coming to our groups long past they finish breastfeeding. So there's lots of really great support too. I'd like to point you to our website and our breastfeeding helpline. Who's heard of the breastfeeding helpline already? Yeah? I've got some magnets here for you to take away. Pop them on your fridge. It's got our website. Loads of information you can look up at, and there's a search bar on the top right-hand corner. So use that to find the information that you need. And anybody can call our breastfeeding helpline anytime. So just a little bit about how breastfeeding works. Okay, so the letdown reflex is a really, really important factor. So when your milk is being made in your breasts, it's inside, but you need to get it out. And the letdown reflex is the process that helps the milk to flow for the baby. There are things that can help that, and there are things that can inhibit that, and they're important to really understand what they are. So things like stress, tension, embarrassment and pain are reasons that can inhibit your letdown. So trying to eliminate those, try to be as relaxed as possible. If you need to make sure that you're really comfortable beforehand, that can really help. And when you're encouraging your letdown, if you're focusing on your baby, you're really sort of interacting and thinking about your baby while you're feeding, that can really help. But there's some techniques that you can use, like warmth and massage. They also will help your milk to flow. So when you're feeding at the beginning, you might notice that you have multiple letdowns. Some women really can feel what that feels like. Other women will never feel a letdown. But you can always tell if your baby's stimulating your milk and the milk is flowing, because the baby's rhythm will change throughout the feed. So at the beginning it's going to be a quick suck, 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 suck rhythm while they're stimulating the letdown, and then it's going to change to a slower sort of suck, suck, swallow type of rhythm. So that will let you know. You can see the baby's jaw moving beside their ear. You'll be able to see them swallow. You might hear milk transfer. There are really good signs that your letdown is happening. And baby may get quite sleepy during the feed, because milk does tend to make them sleepy, and they tend to get tired sucking as well. So they may pause, they may wait, they might be waiting for that next letdown. And then they might start, if the milk starts to flow, you might hear that sucking and swallowing again, or they might stimulate another letdown with another fast sucking rhythm. So just because they've paused doesn't mean that, oh, that's all finished. They might just be waiting for the next letdown, and you can help that to flow as well. So you'll hear the baby's sucking change, you'll see it's changing, and you might hear the milk flowing as well. You may have a sensation. So has anybody heard about the sensation of a letdown, or if you've had a baby before? Yeah, so what have you heard that it sounds like? Tickles? Yeah. Yeah, that's a good description actually. Yeah, so she's describing a tingling sensation, so you might feel warmth or a sudden relaxation. You might feel a tingling or a sudden tension, and then it eases. So that's the letdown happening. So that's a sign that it's happening, and you may notice it more with subsequent babies. You may also get a contraction in the uterus. You may actually feel that, and you might think, oh, that's a bit uncomfortable, but actually it's doing a really good job of helping to shrink that uterus down. You might notice that it's dripping from the other side as well, or even squirting, or you may have a sudden sensation of thirst. So all the dads and partners and grandparents in the room, one of your jobs, leave lots of bottles of water around where mum's feeding. She may suddenly be really thirsty. So supply and demand works through baby sucking and stimulating the milk to flow, and how much milk baby takes from the breast. So they're the things that baby's going to be regulating how much milk you make. But that tends to take a little time to come into balance. Some women may experience a little bit of oversupply or undersupply, and it's very easy to adapt that. So the more milk you remove from the breast, the more milk you'll make. So thinking of it like a jug, the more you empty it, the more you can refill it. So if your baby feel like you need to be feeding your baby a little bit more milk, feeding a little bit more often, removing that milk, you'll start making more milk. And empty breasts make milk. So people sometimes say to me, oh, I sort of wait until my baby's really full, my breasts are really full, or my baby's really hungry to make sure they're going to get a lot. That's not necessary. If your baby's cueing that it's time to feed, take the milk from the breast, and your breast will get the signal to make more milk. So one of the most important things that we teach you, and the most important things that you'll need to learn, is the correctly attaching your baby so that baby can take the milk from your breast. That's going to be really important, not just for making sure baby can take the milk, but for your own comfort. Breastfeeding shouldn't be painful. Although it may be tender in the early days, you shouldn't actually have pain. If there's pain, that's a signal that something needs to be adjusted. You should see that the baby's chin is tucked deeply into the breast, the mouth is flanged really wide, lots of breast tissue in the mouth, and that the nipple's safely back at the back of your mouth. So if you were to suck your thumb, you wouldn't suck it on the end at the front, that's between the jaws. It's going to go right to the back of your mouth. If you put your tongue on the tip of your teeth, slide back and then way to the back, you'll feel it sort of turns to the soft part of the palate. That's where you want your nipple to be, safely at the back there. Okay, so in the baby's mouth, you can see it's stretched right to the back. And I can remember thinking, gosh, how's my tiny little nipple going to get all the way to the back of the baby's mouth? The good news is it's protractile tissue. It will extend if you get lots of breast tissue into your mouth. It's not nipple feeding, it's breastfeeding. We want lots of breast in there, okay? So follow your baby's leads about the frequency and length of feeds. Babies almost always don't go wrong unless they're particularly sleepy or jaundiced and not very alert and not feeding enough. But you almost can't overfeed a baby. Babies are only going to signal what needs are. They don't know anything except what they need. And if you can read your baby's cues and respond to them, then your body and the baby will be in sync with each other. If it does hurt, that tenderness is kind of normal in the early days, but it shouldn't be painful, and any damage is a sign that baby's not necessarily well attached. If there is pain, have a short pinky fingernail, break the suction, not just between the lips, but right between the jaw. Let the air go in, then it's safe to take baby off. Don't pull baby off, because that's going to be causing damage. Get some help as well. So there's Australian Breastfeeding Association counsellors in the community, in the hospitals and health services. You also have access to other services through midwives, lactation consultants, etc. So babies are going to feed 8 to 12 times in a 24 hours period. That's a lot, right? And it can take quite a long time too, but if you follow baby's leads, you almost can't go wrong. So it's really normal too, especially as baby starts to get a little bit older and your milk supply starts to settle down, that baby might feed fairly spaced apart in the morning, but cluster feeding in the afternoons and evenings. So if you anticipate that and put on some food or start preparing your meal early in the day, that means you can sit down, relax, and just feed baby really frequently in the afternoon time. And waking a sleeping newborn may be necessary. And how long each baby, people often say, how long do I need to breastfeed my baby for? Well, every baby and every mother's so individual that it's really not possible to tell. But if you watch your baby and you're looking for signs of baby getting enough milk, then that's going to be a really good cue. So how do I know if my baby's getting enough milk? Well, if it's coming out the other end and it's only breast milk going in the top, that's a really good sign. So we're looking for at least 5 nice, heavily wet, pale nappies in a 24-hour period. Frequent bowel motions for a newborn. They're going to be alert, have bright eyes and good skin tone. So that's, if your baby seems well to you, then they're probably fine. If you feel like there's something not right, then certainly look into it. Counting the nappies over a 24-hour period, that's a really easy way to sort of have a check. So you might notice weight gains, but that's going to be over time. That doesn't give you the reassurance today that counting the nappies, seeing lots of pale urine and frequent bowel motions in a newborn will give you. And make sure you're looking at the World Health Organization charts for breastfed babies when you're looking at those growth charts. And a reminder that we have breastfeeding education classes available. So if you want to learn more about breastfeeding, more about how to attach, these are the kinds of things we go into in a lot of detail in our breastfeeding education classes. And you can book for those online along with all the other information about our local services, including local groups. I have some membership brochures here that are available if anybody would like to take them with you. And certainly please do come and take a magnet as well for our breastfeeding helpline. Never hesitate to ask and reach out. We're here for you. Does anybody have any questions?
Because the mother's milk is full of sugar, so they say it's a good idea to clean the baby's teeth.
So breast milk is healthy for the baby's mouth, but yes, it is important, especially once babies are eating solids, that you are removing food from the baby's mouth and their teeth, yeah. Okay. So certainly look into that. That's a very important thing to do.
The other question I have is about using breast pumps.
Mm-hmm.
Is it something that you would recommend?
So we have information on our website about using breast pumps. And in fact, the Australian Breastfeeding Association does hire hospital-grade electric breast pumps through our local groups at 50% discount for members. And that's really good because it actually comes with counselling. So if it's suitable for your situation, and we will help you establish whether that is necessary. Just because you're going to breastfeed doesn't necessarily mean you have to have a breast pump. Absolutely, yeah. Different scenarios will call for different sorts of situations, yeah.
Hi, and just a question about inverted nipples, please.
Sure. So obviously, just like every other part of us, breasts and nipples come in different shapes and sizes. Inverted nipples, if they're truly an inverted nipple, can actually make it a little bit more difficult, so you may need to get extra support, especially in the early days. So be talking to your health team right from the beginning, letting them know that you have any concerns and learning as much as possible. So there are certainly things that can be done, but yes, you're right, inverted nipples probably are a more complicated situation, but it's certainly not something that means that you won't be able to breastfeed. It just might mean that you need extra support in learning. And very often people who have got inverted nipples, it's actually more flat than inverted. Yeah, so actually check that because you can be worrying unnecessarily. I thought that I did too, and then I found out that I just had very small flat nipples and that I needed to use some extra techniques to help firm it up a little bit, shape it a little bit so that it was easier for baby to get lots of breast tissue into the mouth. But the good news, it's breastfeeding, not nipple feeding. So it's actually getting the breast tissue in the mouth. Yeah. Any other questions? One at the front here. So the question is about how do you know if you have a low supply? So when your baby's feeding according to their needs and signals, then if you're watching the baby's outputs, they're almost certainly going to be a good guide as to what's happening. Some women can feel, especially at the 6-week mark, that their milk supply's dropped. Suddenly their breasts are soft and back to what they were like before they were pregnant, and their baby suddenly seems more fussy. That's a really common misconception that you've lost your milk. What's happened is that the hormones of pregnancy aren't driving any extra supply, and that's really a time to get the meals out of the freezer, relax, sit down, feed baby really frequently, because the more you stimulate your milk supply, the more the milk will come in. Yeah. So low supply is perceived as being very common, but actual low supply is very rare. But if you do feel that you have that situation, certainly be understanding as much as you can, getting help early and not waiting until you're seeing effects from that, yes. Yeah. And keeping an eye on those nappy outputs. Yeah. So thank you very much, and some information's being passed around. Thank you.